The city of Lagos has over time been celebrated for its vibrant spirit and growth. Yet, in the midst of the commendations, there's a pressing challenge lurking in the background: open defecation and urination. It's really not a pleasant sight to spot a person relieving themselves in the full view of the public, nor is it appealing to have to jump over human waste littered along the road. But this seems to have become a norm in specific areas in Lagos State, where some Lagosians defy the laws by defecating and urinating in the open. From bus stations to marketplaces, the lack of accessible and clean public toilets has left many with no other option but to relieve themselves in the public. For some, it's a matter of convenience, but for others, it's a public health and environmental issue that needs immediate attention. The issue of open defecation is one which Lagos State continues to battle with, as places such as the Agege Railway Line, Ladipo and Airport Road around Oshodi, the Abule Egba Corridor, and several others have been significantly marred by this practice. Beyond hygiene concerns, using the loo and urinating in the open pose serious health risks, affecting families, local businesses, and the city's overall environment. These actions increase the spread of diseases, degrade air quality, and make public spaces less inviting. In an exclusive interview with Dr. Anthony Nwanne, a professional health practitioner, he explains what open defecation entails, shedding more light on this vice.
Open defecation is human practice of defecating outside rather than into the toilet. One might choose to defecate in the forest, in the ditch, bush, or open space, if possible canal. Some could defecate outside, maybe because of now accessibility to toilets or that old traditional way of practice. Some Nigerians still believe in the old way of defecating in the forest, in the ditch, in the canal or open space.
Dr. Anthony goes ahead to mention other critical factors that have contributed to many Lagosians still indulging in this unsafe act, despite the threats it poses.
Even though government decided to establish toilets in each of the streets, some Nigerians will not be able to afford to pay the fee involved in public toilets. The last which is homelessness. Some Nigerians are really homeless, so obviously they have where to stay, so they evolve in open defecation.
According to a UNICEF report, an estimated 48 million citizens have continued in the practice of open defecation for years, polluting the environment and making it unsafe to live in. And every year, more than 70,000 children under the age of 5 die from diarrhea as a result of unsafe water and poor sanitary conditions. This is in accordance to a 2018 WASH norm survey. Speaking on the health implications arising from open defecation, how severe they can be, and how to deal with them when they arise, Dr. Anthony has this to say.
Nigerians are not really aware of the health implication of open defecation. Open defecation could cause cholera, could cause typhoid, could cause hepatitis B, could cause polio, could cause intestinal worm infection, can cause different kinds of medical abnormalities, which are cholera, as we have seen in some parts of the world, UK, even in Nigeria, can cause hepatitis B, which is inflammation of the liver, can cause polio, can cause intestinal abnormal infection, can cause dysentery, and can cause diarrhea. Depending on the presentation of the symptoms and level of presentation, this can be severe one if not well managed. For example, if there's outbreak of cholera, obviously the best is to refer the patient to either a primary health care or a general practitioner that specializes in the management of outbreak of such epidemics. I've experience with patients exposed to open defecation, but my advice towards them is when the patient experiences such abnormalities or such symptoms like vomiting, general body weakness, fever, headache, the best thing is to seek medical advice or medical help.
In the bustling city of Lagos, where many are ignorant of the rebounding effect of simply responding to the call of nature in the full view of the public, the need for a lasting solution continues to arise. While the Lagos State government has made significant strides against open defecation through cleaning initiatives and enforcement measures, there is still a crucial need for continuous public awareness on the health risks of this practice. Consistent sensitization, coupled with increased access to proper toilet facilities in underserved areas, would ensure lasting progress. With these efforts in place, a healthy, safe environment where every Lagosian can thrive becomes a realistic goal. Have you noticed areas where open defecation is still a concern? Let us know in the comments. Stay tuned for more insightful coverages and reports from The Guardian TV.